30,000 acre wildlife area. Dr. Eric Anderson, co-chair of programs, will introduce our speaker. Eric?
I doubt that many of you have ever heard of a woman by the name of Molly Murray or Judith Mensch. These are two mothers that lived in the 1970s in southern Connecticut. And they also had, independent of one another, a child that manifested a disease relatively rare that was initially diagnosed as juvenile rheumatoid arthritis. Symptoms of that were swollen knees, rashes, headaches, paralysis, oftentimes of the face, and oftentimes severe chronic fatigue syndrome. So all of these things wrapped together happened to these two women that didn't know each other. As they started looking into it, they discovered that it wasn't just the two children, but there were dozens of children and adults in the same area that they lived in, which happened to be a town in southern Connecticut known as Old Lyme, Connecticut. Mid-1970s, these women brought to the attention of the scientific community this problem that was emerging. The scientists, no one saw it as a big-scale issue. They saw individual people that had juvenile rheumatoid arthritis, but some things didn't quite fit the diagnoses. It took them 6 years from the time that their kids came down with that, and it wasn't just their kids. Mrs. Murray herself ended up with this disease before they discovered the bacteria that actually caused this thing that bears the name of the town that they came from, which is Lyme disease. So, Lyme disease right now is one of the fastest growing vector-borne infections in the United States. The Center for Disease Control actually estimates there are over 329,000 new cases of Lyme disease every year. That's a third of 1 million people that are contracting this disease on an annual basis. But perhaps even more significant than that is there are at least 5 other tick-borne diseases that are currently found in Wisconsin, some of which have quite a bit more severe symptoms than does Lyme disease. Our speaker this evening, Dr. Elizabeth Maloney, a graduate of the University of Minnesota Medical School and a family practice physician from Wyoming, Minnesota, is also the president of the Partnership for Tick-borne Disease Education. She's lectured extensively to physicians, healthcare professionals, and lay audiences as well about tick-borne diseases, and in particular about Lyme disease. She and her husband drove over this afternoon from the Twin Cities through this pouring rain just to be able to give this presentation this evening. So if you would please, let's give a warm welcome to Dr. Maloney.
I'm very pleased to be here, and I think you are great party people to come out in the rain. But I'm hoping that by when you leave tonight, that when you're out birding, that you'll be better prepared so that you can think about the birds and not the ticks. And so here's my little nonprofit. I'm really open to educating anyone who will listen. And I do it in all sorts of formats. I've even had to take my teaching online because some doctors were afraid to come to live seminars because they were worried their colleagues might think less of them. And so I now know how to do things online. So they tell me to always tell people what you're going to talk about, then talk about it, and then remind them what you talked about. And so we're going to talk about Lyme, the illness, because I want you to know what it really can do to people. We're going to talk about who's at risk for getting Lyme disease, how you actually acquire the infection, and all the things you can do to keep yourself from becoming one of the victims. So we can talk about Lyme in 4 sentences. It's a bacterial infection. It's spread by deer ticks or black-legged ticks. There's 3 stages, and the signs and symptoms vary between people and in the same person. but I think you want a little more detail than that, so let's go for it. Here's the bacteria, Borrelia burgdorferi. Anyone have spaghetti tonight for dinner? That's what I always think about when I see this slide. So generally, the bacteria it's a spirochete, and so it's in this form. But it does, at some occasions, take other forms that might actually turn out to be very important. We say it's zoonotic, a fancy word for saying it can infect multiple animal species. And think about the species, because it can infect ticks, mammals, lizards, and birds. So when a bacteria has that type of capability, we know that it's adaptable, and adaptable organisms survive. Now, Borrelia burgdorferi, sensu stricto, is the fancy name for the bacteria we have that causes most of the cases of Lyme disease in the United States. Europe has 2 additional species to deal with, Guerinii and Apzelii. But there are actually on our family tree of Borrelias, lots of them. And some of these do cause sporadic cases of a Lyme-like illness. Mayo Clinic had to get into the game, and so it found its thing about 7 years ago in residents from Wisconsin and Minnesota. But now we find there's another tree in the forest. So there's relapsing fever bacteria, Borrelia miyamotoi, which also causes a Lyme-like illness. So it gets a little confusing. And the reason I point out that there are different species is that they really can have an impact. For instance, we know that certain species prefer to go to certain places in the body. Borrelia apzelii, one of the European ones, prefers skin and joints, but doesn't really usually go to the nervous system. Borrelia guerinii does go to the nervous system. And then our Borrelia burgdorferi, it's an all-purpose bacterium, and it will go anyway. It also affects testing. If you go to Europe and have a grand time in Bavaria, one of the worst places in the world to go for tick-borne diseases, and you pick up their Borrelia guerinii, and you don't get sick until you come home, you might not test positive on tests that are created to find the U.S. species of Borrelia. And it may affect treatment as well. It seems that in the test tube anyway, sensitivity varies depending on what species we're testing. So Lyme disease, I said, has 3 stages. In the early stage, or the acute stage, it's in your skin. It got there by the tick bite, and it's just hanging out there, sometimes moving. It can cause a rash, or it will cause flu-like symptoms. Late disease is when the bacteria has managed to get out of the skin and into other places to the body. And then finally, in persistent disease, those are the people who remain ill after antibiotic therapy. So, early disease. It begins usually 2 to 30 days after a bite, most typically 7 to 10 days. It can show up in many different ways. Some people have no symptoms at this stage, or nothing that they recognize. Other people develop that famous Erythema migrans rash, and I have photos of that to show you. Some people get a flu-like illness, and then the lucky ones get the rash and the flu. They're lucky because their diagnosis doesn't get missed. And so I think that's a good thing. The symptoms are variable. Most people in early Lyme disease will have fever and chills, and they'll also have headache and stiff neck and joints. So they have a lot of joint pain, neck pain. Sometimes they'll have numbness or tingling or even a sore throat. There's not a lot to see. Oops, I went ahead of myself. So we can see the EM rash. Sometimes people have a swollen glands or the back of the throat looks red. This is a bacterial infection, and we treat bacteria with antibiotics. Now I know that many people prefer to use herbal treatments for various ailments, but I would strongly recommend to use antibiotics for Lyme disease because we want to kill it at this stage, because if it gets beyond this stage, it's much harder to treat. It's important for you to know that if you have an Erythema migrans rash, you shouldn't be offered a blood test. And the reason for that is testing at this stage is often falsely negative. And so if someone shows up with early Lyme disease, I tell my colleagues, just treat them. So here's the rash. That's the most common rash of Lyme disease. How many of you were expecting a bullseye? That's what we were all taught, right? Look for the bullseye. I tell my colleagues, if you're only looking for bullseyes, you're way off target. That's right, left, right. And so, in studies, we found that really it's a solid colored oval. And the formal name is erythema for red. And migrans, and in this case, movement. So this rash will expand and then contract. And it will go away even if it's not treated, and that can be a fooler. And especially so because the rash doesn't really itch or burn or anything, it's just kind of there. And so a lot of us, we don't go to our doctor for something that's just there. But that's when we really do want you to come in. But 30% of people with early Lyme disease never have the rash, and that's based on CDC statistics. And so it actually turns out, with early Lyme disease, you're more likely to have no rash than to have a bullseye. Yes?
Does that happen right where the bite is?
Yes, thank you for that question. So the rash develops at the site of the bite. See, what has happened is the tick has bit and it has injected the bacteria into the skin, and now the bacteria are moving around in the skin. And that's why the rash expands. So it starts at the site of a bite. Now some people, and I'll have a picture of it, have more than one rash. So here are some more erythema migrans rashes. And I gave you the bullseye here, just so everyone feels good about that. But it can be really faint. And if it doesn't itch or anything, you might let that go. It can look very unusual. So I think that I would have thought of eczema, look kind of that weepy lesion behind a knee. In people who are more highly pigmented, the rash can look like a bruise. Here's one for you to remember. If I didn't know, I would say this was cellulitis. Okay, so we treat cellulitis with something called cephalexin or Keflex. Keflex does not work for Lyme disease. So if you get cellulitis during the summer months, during tick season, ask for something that will take care of both garden variety cellulitis and Lyme disease. So that would be something like Augmentin or Ceftin. Because we don't want to mistake your rash and give you the wrong therapy. So after the bacteria has wiggled around in the skin, it ultimately will find a blood vessel. And once it hits the bloodstream, it can go anywhere. And it really does go anywhere. And so this is what I'm going to show you now. Early on, people have even more symptoms than they did at that early stage. And so now some people show up with multiple rashes. The joint pains and the headaches become more of a problem. Now you start to see the onset of nervous system involvement, all the way from a facial nerve that doesn't work to mood swings, light sensitivity, photophobia. People are wearing sunglasses often in the house. The fatigue of Lyme disease is not I had a busy weekend. The fatigue at this stage is the young mother who said, I couldn't get out of bed even though the baby was crying. And the pain that some of these people are experiencing, besides the typical joint pain and muscle pain, is nerve pain. So it's neuropathic pain. It's very similar to the commercials that they have for diabetic foot pain. So luckily, the same things that we use to treat that will work for many of the people who have neuropathic pain due to Lyme disease.
Doesn't it itch or anything at all where you get bit?
No, it usually doesn't. So these are great questions, so I'll take it. The interesting thing about the tick and the tick saliva is it contains all sorts of things that benefit the bacteria, which makes sense because the bacteria and the tick have evolved together. And so in the saliva is an antihistamine. There's also an anticoagulant because the ticks feed for several days.
So you could get bit and not know it then?
Right, and there's an anesthetic. And in fact, when you look at studies of people who were in trials for treatment of the rash, only about 20% of them recall the bite that gave them the rash. So most bites go unnoticed, which is why we're going to talk a lot about prevention. So here are some of the other syndromes that you can see with Lyme disease. So in this first photo, this is not a person who fell into a nest of ticks. This is the bacteria got into the bloodstream and was able to circulate back to the skin and cause multiple rashes. When that happens, sometimes the rashes will be small. They won't get to be the big expanding rash. 60% of people will have arthritis if they don't get treated. It's usually in the knee. But it can affect any joint, and so once in a while, someone with Lyme disease gets misdiagnosed with rheumatoid arthritis. Over on the far left, we see a woman whose facial nerve is not working well, so she can't really smile in that photo. In areas where there's a lot of Lyme, when facial nerve palsy shows up in children, about half the time it's due to Lyme disease. Here's another take-home point. If you get diagnosed, or someone you know, with facial nerve palsy or Bell's palsy, which it's really not, during tick season, make sure you ask the question, could this be Lyme disease? And because if we think it's Bell's palsy, we'll give you steroids, and there's now studies have shown that giving steroids to someone with facial nerve palsy due to Lyme disease makes it much harder for them to fully recover. So you need to raise these questions. Lyme can cause a meningitis. It's a smoldering meningitis, so that most bacterial meningitis is like, boom, you have meningitis. This one, people are sick for maybe even a week before they come to see their doctor. It's often a headache, low-grade fever, a stiff neck, but they can still bend their neck. It's often misdiagnosed as viral infection because when we do that lumbar puncture, when we do the spinal tap, there aren't very many infection-fighting cells that we would expect to see, so we think it's viral. Lyme can affect the heart, and it can affect any layer of the heart. The most dramatic is when it hits the electrical system, because it can make your heart stop beating. And so the CDC about 5 years ago now published a series of 3 young healthy adults whose first symptom of Lyme was sudden death. And so we need to take that seriously. It can cause weakness of the heart muscles, so you have symptoms of heart failure. And it can affect the covering of your heart, the pericardium, and so when you go to take a deep breath, your heart fills with blood and it stretches and it hurts. And so Lyme can affect the heart in many different ways. Late neurologic disease is the one that trips my colleagues up the most. It can come on months or even years after the bite, which is why it's hard to make that association between bite and illness. It can cause malfunction at any level of the nervous system. So it can be the brain, the spinal cord, or down to the peripheral nerves. Lots of different symptoms. Now and then we'll see Lyme masquerade as MS or Parkinson's or ALS, Alzheimer's. And this is an important thing to remember because most of those diagnoses are terminal diagnoses. We don't have curative therapy for them. Whereas if we get someone with Lyme disease diagnosed properly, we do have therapy for that. So while I don't mean to say that everyone with MS and ALS and Parkinson's has Lyme disease, some of them actually might. And I always tell my colleagues, we need to entertain that idea and check that out. But the more common problems are numbness and tingling and that neuropathic pain. Some people will complain of difficulty thinking. And the formal term for that is Lyme encephalopathy, which has actually been pretty well studied, but it's not part of the CDC definition of Lyme disease. So we don't know how many people are out there with Lyme encephalopathy. I knew an architect that had to retire because he kept transposing numbers. A very bad habit if you're an architect. Now, it's a tricky diagnosis because the symptoms change. Every day, the symptoms can be different in the same patient. And they're very different patient to patient. Strep throat looks like strep throat, looks like strep throat. And bladder infections pretty much look the same too. But Lyme does not look the same person to person, and that is confusing. It also has kind of a waxing, waning course. That roller coaster makes you're really sick. Oh, I'm getting better. I'm better. Oh, I'm sick again. It doesn't really make sense. Most infections don't behave quite that way. And because it looks like other diseases, we often have problems getting the diagnosis correct. So here are some of the diseases I tell my colleagues to consider if they're thinking about Lyme disease, or if someone has one of these diagnoses that they might consider whether the person has Lyme. So it's a long list, but we can move through it pretty quickly and do some testing when necessary. But blood tests are not reliable. They look for antibodies. They don't actually look for the bacteria itself. And so when you're looking for antibodies, we're making some assumptions that everyone's body makes antibodies in the same time frame and in the same way, as robustly as the guy next door, and that might not be the case. So for instance, if people are on steroids for a different illness, they might not have the same robust antibody response. Also, it takes time to build an antibody response. So if you come in with your rash on day 7, your body hasn't had a chance to make antibodies. If I test you, you're more likely than not going to be negative. And if I take that negative test and say, I don't know what that rash is, but you don't have Lyme disease, well, we both are in trouble because we did it wrong. So that's why we don't want to have testing in early disease. We can also test too late, which is a funny concept. But remember, this is an adaptable bacteria, and if it's been in the person for a long time, it's already learned how to outfox the immune system, otherwise it would be gone. And so antibodies in monkeys, they found in untreated monkeys, started out appropriately with a high response, but over time went back to normal, even though the animals were still infected. And they knew they were infected because they sacrificed them. But we do know in someone who really looks like they have Lyme disease and we don't have another diagnosis, if you get a positive, that is not a false positive. That's a true. But negative tests are the ones. We can't say a negative test rules out Lyme. So I always think of Lyme as kind of this teeter-totter. Sometimes it rises to the top and the mimics are down below, but sometimes I'm really dealing with a mimic of Lyme disease. And so we have to consider many, many things when we're making a diagnosis. And so really the thing that I tell even the Lyme support groups is our goal is not to be diagnosed with Lyme. The goal should be to get the diagnosis right. And so I tell people, if you live in a Lyme endemic area and you have symptoms compatible with Lyme, don't tell your doctor, I think I have Lyme, because that puts blinders on your doctor. Just let them try to work through the problem. I think you'll get a better result that way. So I don't want to go into treatment in great detail, but I'll tell you a few things. It's most effective in early disease. I would say, looking at the literature when I analyze it, at least it's probably in the 75–80% range cured, but not everyone gets cured. We don't know why treatment fails. There's many theories, few have been proven. We do know that the bacteria can persist. We're not really sure why or why that's happening. And then we don't know what to do when treatment fails. And that's where the greatest amount of controversy is. Because we've had a few little studies that were not well designed, that didn't find anything, and then a couple others that were even smaller that did find that treatment helped if you had the very, very severe fatigue. But other than that, there hasn't been studied, so we really don't know. I do want to tell you that, well, I'll talk about tick bites in a minute, but if you get early Lyme disease in this area, in Wisconsin and Minnesota, I would recommend you get at least 3 to 4 weeks, depending on how sick you are. If you come in when you have several rashes all over your body or nervous system problems, definitely try to get on the longer range. You know, you're going to have to be assertive. If you have persistent Lyme disease, you might need to find a doctor who has seen a lot of those cases. They're few and far between. But I think there's a new institute coming to Wisconsin. If I get more information, I'll pass it on to Eric. So the official numbers that the CDC reports, so you always hear, well, there's 30,000 cases this year or 35,000 reported cases. And it's been generally plateauing in the upper 30s. There was a peak last year. But it is the most common vector-borne illness. And vectors are, I think of them as the middleman. So they help spread the bacteria from one host to the next. But the risk is much higher. It's much like this iceberg. So if the CDC is telling us that there's 35,000 new cases reported each year, they actually did some different looks at it and found that it's over 330,000. And part of that has to do with how physician-reported cases go. We just aren't very good at doing it. Now, Lyme disease is a serious illness for some, not all. In fact, that's why I would rather have people get extra antibiotics on the front end so that they don't have to deal with the effects of Lyme when things don't go well. So in a survey of people who didn't get well, 65% of them had to cut back on work or school, and a quarter of them ended up on disability. The cost for an average case is pretty high. And that's because we have to factor in all the people with late disease or persistent disease. That's what drives the cost. But even in early Lyme disease, when we think of cost, not just the cost of the doctor visit and the medication, but it's the missed work, missed school. So there's all those other costs associated with it. But as you get a more advanced case of Lyme disease, it becomes very expensive. Oh, I was quick on the draw there. And then in some places, it's hard to get care. So the realtors always scream, location, location, location. And look at that map. And, you know, you can't help but look at the black areas, right? But I want you to adjust your eyes and just come down. Look at Florida. Come around the coast. Pockets in San Francisco and up in Seattle. My son moved from Minnesota to Seattle. Good call. And here's the upper Midwest. I live in kind of that black part in here. So you folks know we're under the gun here. So here's a state map, and I really actually like how your health department approaches their Lyme disease webpage. Is quite nicely done. Hats off to them. I want you to know that you can get Lyme anywhere. So in many states they think about it's more of a rural disease, but then you can get it in lots of metro areas. So you'll find it in golf courses, all those places there. And I always like to look at these two maps because it's the difference between incidence on the right and reported cases, because of course they don't always match up one-to-one, because if you get a few cases in a county that doesn't have much population, it's going to make that county look brighter than if you have lots of cases in a county with a huge population. But generally speaking, you can see incidence-wise, as you go north in the state, it gets pretty significant. So who's at risk? Well, you guys are, for sure. And I hope you knew that before you came. Maybe that was a motivator. People who live in carved out neighborhoods, when we carve the woods up, we actually increase the risk of Lyme disease because the larger mammals are driven out and the smaller mammals proliferate, and the ticks are actually more likely to be on the smaller mammals. So you have all those mice running around your property, that puts you at risk. Certainly if Bambi comes by for a visit, you know you're in trouble. Slide's probably a liability too. People who have outdoor activities that put them where the ticks are, obviously at risk. Pet owners are at risk because pets go sometimes where we have the good sense not to. If you have an indoor-outdoor cat, and you're in a Lyme area, you're at highest risk because the cats, if you let that cat out, they really prowl around, and cats tend to snuggle and get more places in the house than the dog. And then the risk is age-related as well. So school-aged children followed by middle-aged adults. I'm always puzzled by this bar graph because where are those 20 and 30-year-olds? Aren't they the ones who are out enjoying nature? Why aren't they getting sick? I suspect it's because their immune systems are working at peak performance, but I would like someone to study that, because if we can figure out why they don't get sick, maybe we could spread the news to the rest of us. Deer ticks spread Lyme, and so you all should have your tick cards. If you didn't get one on the way out. I want you to know what that tick looks like. So it's got a beautiful reddish-brown body and then a black scutum or cape. It's 8 legs, so it's arachnid. Here's the tick family photo. mom, dad, big brother, little sister. So the adult female is bigger than the male. Here's the nymph and then a larva. This is a centimeter rule, so we're talking a millimeter size for a nymph. And those are the guys that are coming out right now to bite you. And they are tiny. That's a nymph on a fingernail. I once asked a friend, a patient of mine, how she found that her tick. And she said, well, it was a freckle that I didn't have, and it had legs. And so you have to know your skin pretty well. I don't want to make you entomologists. I just want to point out a few things. Here's just one generation of ticks. So eggs are laid, and then they hatch into larvae. Larvae are not infected. So if you happen to get bitten by a larva, no worries. But if that larva bites something that is infected, it comes infected and will stay infected. And then when it bites again as a nymph, it can pass on the disease. And then adults in year 2 take a third bite, the females. And then that's it. And then the new cycle starts the next year. So they really only live for 2 years, and they only take 3 meals. But in many parts of Minnesota, the ticks, the nymphs are more than 50% infected with Lyme disease. And I bet that the same is probably true here as well. So ticks need moisture. They dry out quite easily. So they're under the leaves, they're by logs, they're in wood piles. In homes, they are by bird baths because there's going to be more water in the vicinity of a bird bath. And they're by bird feeders because mice are coming up and getting the stuff that falls to the ground from the bird feeder, and ticks are on mice and drop off of mice. So here's a friendly gal just hanging out on that blade of grass. And she's just waiting for something to go by and brush those outer legs, and they'll just grab on. So on their own, they do not travel far. They do not come down from trees, and they don't jump. But they can ride for long distances if they get on a deer. And if they get on a bird, they can really go. For a while, Canada said, we have no Lyme. And then someone said, well, gee, the cases that are emerging are along the flight paths of the migratory birds. And so, Canada does have Lyme. And pets and people often bring ticks indoors. And so you might be doing everything right, but if your spouse doesn't wear their permethrin, then sometimes you're at risk. So, in your state, there are 3 ticks that are pretty common. The first, we have the deer tick, black cape. And telling this from these guys is really kind of a black and white exercise. So the dog tick, or the wood tick, has a white cape area, right? And the Lone Star tick, which has come up from the south, has that single white dot. And so telling them apart is just a matter of looking for those markings. So if we come over here, any guesses as to whether this is a wood tick or a deer tick? Does anyone want to tell me what's on top? Okay. It's the dog tick or the wood tick on top. So if you look, you can see that white little cape area has stayed there. So the capes never get bigger, they're a fixed size. And so as that tick's body expands, it seems to disappear. There are other things in ticks besides the Lyme bacteria. In fact, in this state, there are lots of things. So there's Poisson, which is a viral infection that we don't have any therapy for. There's Babesiosis and Anaplasma, so we'll talk about those. But look, you even got one named after Eau Claire. The take home from that is a single bite can give you multiple infections. And someone with more than one infection makes it even more difficult to figure out what's going on. I just want to talk briefly about anaplasmosis. It's a cousin to ehrlichiosis. Ehrlichiosis is spread by a different tick. It's spread by the Lone Star tick. But so Minnesota and Wisconsin are at high risk. This is a potentially serious infection, especially for the very young and the very old. There are some transfusion-related cases, which tells me that this can be a chronic infection because normally super ill people aren't donating blood. People are sicker than the people with Lyme disease. They really are sicker, but they don't get rashes. And here's the bacteria. It likes to go into a certain type of white blood cell and cluster. And so what happens, of course, is that the white blood cells can be disrupted. We can find the bacteria under the microscope, and there are some tests that we can do for it. But if we have any suspicion that we're dealing with anaplasmosis, we're supposed to start treatment immediately. And it's with doxycycline to anyone, even children and pregnant women, because anaplasmosis is a very serious disease. And then the other one, just briefly, is babesiosis, which is caused by Babesia microti mostly. It's like a Midwest malaria. And so instead of going into white blood cells, it goes into red blood cells. And it can cause tremendous problems. It will cause fever and chills, bones just ache. It will cause anemia because it's breaking up the red cells that it has affected. We can feel a large liver and spleen, and you might be jaundiced. The part of the life cycle of this parasite is within the liver and spleen, and they get big when it's in there. And then as you break your red blood cells down, all that hemoglobin is released in your body. If it can't process it efficiently, that's when you become jaundiced. And there's testing that we can do, but mostly we're looking for the bacteria under the microscope. The treatment is trickier for Babesia. We use things that we don't use in Lyme disease. In fact, we use some drugs that, one of them is a Tick-borne, and we usually only use that in HIV. So it's a trickier thing. And so it makes symptoms hard to discern what is going on with the patient if the person has more than one infection. Also, someone might have symptoms that we think are Lyme disease, but really it's anaplasmosis. And then it complicates treatment. People can end up on more complicated drug regimens. So I'm hoping by now that you have decided you would like to avoid the rash, the arthritis, and the facial nerve palsy. And if that's the case, then you must avoid this. The tick bite is the bad culprit here, so we want to avoid it. It's really a three-legged stool. You have to have a strategy for people, pets, and property. Because if you do everything for you and you don't do anything for your pet, your stool is not going to stand and you're still at risk of Lyme disease. So for people, it's a layered approach. And basically, don't get bitten. If you get bitten, take it off quickly. And sometimes take antibiotics, even though you haven't fully gotten Lyme disease. So if you can limit your exposure, and I know for you that might be difficult, but especially in the late spring when the nymphs are really out in force, if you can be very mindful, that would be great. The last thing I want you to do is sit on a fallen log. That's the highest concentration of ticks in the woods are by the fallen logs, probably because that's a natural place for mice to hang out. We're not going. Yes, we will. Any suggestions, Eric? Oh, I'm just going to use the arrow.
Great, okay.
So, dress for success. If you're going to be out in tick habitat, ideally wear light clothes. And that's because it's easier to find the tick on the light clothes than on your jeans. So it should, and yes, you can look as nice as this. So tuck your pants into your socks so that ticks can't crawl up under the cuffs. Cover as much skin as you can. They cannot bite through clothing. So cover as much as you can. Wear a hat. If you have long hair, put it in a ponytail or secure it so it's not swishing around. All of your clothing should be treated with permethrin, and I'm going to talk about that. When you come in from tick habitat, throw your clothes in the dryer on high heat for about 15 minutes if they're dry, up to an hour if they're wet. That will kill the ticks.
Can you wash them first?
You can wash your clothes if you want to, but washing will not kill
No,
the
but if
ticks.
you wash and then throw them in the dryer?
That's fine. But make sure you get them dry. In the dryer, yeah. Don't line dry. So permethrin is an insecticide, and you want to use this. It will either kill or stun the ticks on contact. And you can put it on clothing, on camping gear, on anything that you take out into tick habitat. It's very safe that way. It's long-lasting protection, which is nice. Unlike a repellent that you have to rub on every couple hours, applications of permethrin hang around for weeks. If you treat at home, you can find brands where it's good for 6 weeks and several washings. I tend to be forgetful, so I usually like pick a day, the first of the month, and do it every month on the stuff that I wear out in tick country. But if you're good with the 6 weeks mark, you can send it up all that way. There's a company that will factory embed permethrin into clothing. The manufacturer says that it's good for 70 washings. There was a recent NIH paper or CDC paper that suggested maybe the effectiveness drops off after 16. But 16 is better than nothing. And so that's insect shield. But you can even do tents and sleeping bags. I worked with Camp Tomahawk a couple years training staff because the staff were all getting Lyme disease. And one of the things I suggested was to do the tents and even the outsides of their sleeping bags. And so choose what you'll use. There's all sorts of products out there. If you like spraying aerosol cans, buy that aerosol can. If you are more of the pump person, get the trigger. You can use dips where you have a super concentrated and you put it in the garbage bag size, and that's really great for the sleeping bags and the bigger pieces of equipment. But you have to use it. It doesn't do you any good in the container. Various repellents for your skin. I know that we're moving towards more natural products, which is fine. If you're going to use a natural product, the only one that has demonstrated efficacy with the FDA is oil of lemon eucalyptus. So all the other botanical things that are being marketed, well, that's marketing. But if you want to be effective prevention and you want to go natural, oil of lemon eucalyptus. My personal preference, I use picaridin at home. It doesn't hurt any of your gear. Sometimes DEETs can be hard on rubber or certain clothing. So I tend to find picaridin. And there's several products. All the outdoor stores usually carry a variety of these things. And then when you come in, you know, sometimes despite our best efforts, we will get a tick attachment. And that's why we have to do tick checks. The sooner you get the tick off, the better. Because usually they can't transmit disease unless they've been attached for 24 hours. But it's a careful search. You have to look everywhere. If the child's head has been under a hat, then you can maybe feel a little less inclined to go through all that hair. Ideally, if you should come in your house, strip off your clothes, and go take a shower. Because there's been shown that if you shower within 2 hours of a tick attachment, you can actually shower that tick off, either by vigorous scrubbing or by toweling off. So that would be the sequence of events that you should do these things. And then, again, just a reminder, these are very small targets. If you do find a tick, then I tell you, don't freak out or scream for a minute, but then gather your wits. All you need to do is get a tweezers or some type of pincher, squeeze the tick as close to the skin as possible, and pull straight out. Try not to jerk. These ticks are a little bit harder to remove than the wood tick. They kind of cement their mouth parts into the skin. And then just wash the bite site. You don't have to do anything special. If you can save the tick for your doctor to look at, that would be ideal because that helps verify what species of tick you are dealing with. Don't try to cover the tick with things. You know, usually in the spring I'll get the liquid soap email chain, or people seem to like kerosene and gasoline as a repellent. And then when that doesn't work, you know, there's always burning, which doesn't go well if you've already tried the gasoline. So here are some options. And I've written a paper that was actually in the Wisconsin Medical Journal about 8 years ago now on how to manage tick bites here in the upper Midwest. And really looking at the studies that are available, you should probably get 10 to 20 days. And that's based on mice, which is kind of a sad thing. I'm giving you a recommendation based on mice. But the other study done in humans wasn't that effective. What they actually measured in that study was not the prevention of Lyme disease. They measured the prevention of the rash. Well, most people don't care if they prevent the rash. They don't want to get the neurologic problems. And so this is probably only about 50% effective for prevention. And then we don't want to watch and wait, because sometimes there's nothing to see, right? 30% of people don't get a rash. So you've missed that window of opportunity. Regardless of what choice you and your physician make together, do be mindful, and if you develop symptoms of early Lyme disease in particular in the next month, go in and get treated. And remember, don't rely on testing. For our companion animals, it's the same general strategy. So try to keep them out of tick habitat. There's lots of products for pets, and I'll show you a graph of that. Do tick checks on your animals when they come inside. I know that's a challenge with a dog like that, but there's my Angel, and she got vaccinated, and she was frontlined, and she got Lyme. So, as I said, I'm not a veterinarian, and I'm not playing one tonight, but I can tell you a few things about these products. They aren't necessarily weight-based, and there certainly are species-specific. Cats in particular, permethrin is toxic, and some of the other dog products will kill a cat. And so you really do need to talk to your veterinarian to make sure you're getting the right preparation for your pet. Also, it depends if you have like a water dog, then some things are better for that than others. And finally, for our property, we want to enjoy it, but we don't want unwanted guests. So we don't want the mice and ticks and deer. So you have to get rid of the things that attract mice. You have to get rid of things that harbor the ticks. I would think as a kid that that's where I would want to play. It looks cool, and I could let my imagination run wild. But we really need to move that play structure out into the sunlight, because the sunlight will kill ticks that might be around there. There's Bambi in the backyard, and what I really want to show you is see how the lawn abuts the brush? Right where the ticks are. That's my backyard, and I mow the lawn. So we had to put in a buffer zone. Now, it's not that the tick can't crawl 3 feet over some rock. It's that when I'm mowing the lawn, I'm not in harm's way. You don't want to set out a smorgasbord for deer. And there are certain things that they love to eat, and certain things apparently that they don't. You also want to avoid having plants where the mice can hang out. So unfortunately, Japanese barberry is pretty dense and prickly, so we tend to not maybe clean the leaves out there, and so that's where mice go. And so a lot of ticks you'll find by certain plants like the barberry. And you want to replace them with graze-resistant plants. So the not courtesy. This is courtesy of the Connecticut Master Gardeners. By the way, I have a similar slide presentation on my website, so if you need to see these slides again, you can, and they're narrated. So I'm sorry to all the gardeners if your favorite thing needs to go. Yeah. There are landscape insecticides, and I'm not an expert, but Kirby Stafford is. So he has a lovely handbook that you can refer to. All you have to do is Google Tick Management Handbook, and you'll get to his website. But think back into the life cycle of the tick. The first time you treat, generally there's an application in the spring to get the nymph, and then another application in the fall to get adults. And then after that, it's usually a spring application. Not everything needs to be treated, just where the ticks are most likely to be. So we don't want people spraying chemicals all over their lawns. People that live by water, such as a creek or a lake, they should probably consult a professional, because these chemicals are toxic to aquatic life. Here are some resources. That's my website. Columbia University is doing research on Lyme. They have a very good website, as does the Lyme Disease Association and the Minnesota Lyme Association, which I work with. So to summarize, Lyme really is a significant, complex illness, and the risk is growing. We really can't ignore it any longer. Prevention truly works if you use it, but you have to employ multi-layered strategies, and all 3 legs of the stool need to be standing. And there she is. If you take nothing away from tonight's talk, I hope you'll remember this simple phrase. An ounce of Permethrin is truly worth a pound of antibiotics. Thank you, and I'll take any question you want to throw at me.
Please go back to your slide that said what you should have in your yard.
Oh,
On
sure.
the top it was, these are the things you should get rid of, and I didn't get to look at the bottom of that
Oh, this one you
slide.
get, there we go.
Yeah.
Are you able to get a copy of your presentation anywhere?
Yes, on my website, which is Partnership for Tick-borne Diseases Education. This whole slide, a very similar slide set is narrated, and you can just watch it to your heart's content. Yes, sir.
You have suggestions for how to remove the tick that's embedded?
Removing an embedded tick, I would still try to grab it as close to the skin as possible and just pull. The reason it's not that it's so much buried that there's swelling around it.
Right.
Yeah. Yes, ma'am.
So I think you touched on it with the 24 hours to transmit the disease. So let's say you're in the woods and you get back home and within 2 hours you find a tick and you remove it. Do you need to be worried? Does it need the full 24 hours to transmit the disease?
I personally would not be worried. So the question was, how many hours to transmit Lyme disease? You know, all of life is a risk thing, but the risk is very, very small because the transmission of the bacteria lives in the tick's midgut, and it's attached to the wall via a certain protein. And when blood comes into the gut, that's a signal to the bacteria that it can move now. So it has to stop making that protein so it can detach. So that's a process that plays out over time. It's not just like injection of something. And so that's why I personally think that 24 hours is a great cutoff. There have been some mouse studies where when that transmission occurred in a small percent in less than 24 hours. But other studies have looked at a single attachment and they didn't find any in under 24. Yes, sir.
If you get a tick off, do you save it and take it to the doctor when you go in?
If you take off a tick and you think you don't know how long it's been on, or it looks like maybe there's a little bit of blood, by all means bring it in, because many of the physicians aren't going to take your word about what species of tick. Bring your tick ID card because they might need to look it up. Well, you know, I'm serious. We look up a lot of things all the time.
So you're supposed to take the tick and like put it between something?
No, don't put it in tape. Put it in a baggie,
Okay.
a zip, anything that you can put, so we can look at
No,
it.
but what if it dries out?
Put a cotton ball with water in it.
Oh, okay, because sometimes you can't get to the doctor right away, but
I know.
sometimes it's
You know-
going to dry out.
If you have a tick bite, kind of insist that you get in. Because they should be able to triage that in an area where there's a lot of Lyme, because that's an easy thing. You show them the tick, we look, okay, here's your prescription. But yeah, do save the tick, because you know, sometimes people tell me, well, I had a deer tick, and they show it to me, and it's not a deer tick, you know. It was a small
So will they
infant.
really would actually take it and send it to the lab, or?
No, they're
just
gonna look at it.
Placate you?
No, I think that they should look at it
Okay.
and verify the species, and then try to get an idea of if the tick is fed. Because in a high-risk state like Wisconsin, if there's evidence of tick feeding, then I would give that person prophylaxis. I would try to prevent Lyme before you're even symptomatic. The trick is, if you get a tick bite and we're going to go that approach, we're going to give you preventative antibiotics. It looks that if we don't start them within 48 hours, they become very ineffective. So you have to badger to get in as soon as you can. Yes, sir.
Kind of a two-part question. Can you have a mild case of tick, and could a person who had that develop an immunity to the greater case of it?
Good question. So can you get a mild case that then leads to immunity? Unfortunately, no. So repeated cases of Lyme occur, and sometimes with each new infection, symptoms seem to be magnified, so, no. Yes, sir, right?
Why, in the past, has there been so much hostility between groups of doctors, between treatment for Lyme disease? Some people, I've even been yelled at by a doctor who says, there's no Lyme disease around here, there's hardly anything. And then the other doctor I have said, here's, keep the doxycycline on hand, I know you know what a black-legged tick is. So.
Well, yes, it's a very controversial medical illness, and controversies usually arise when the evidence is limited. So we don't know, and so people stake out positions. And the other issue that's in the background of all this is antibiotic overusage. And that's an important thing. And so, unfortunately, people started taking their positions before we had enough strong evidence to really stand our ground on any position. And so one of the things I do with physicians is say, okay, let's really look at the evidence. Let me lay out the studies for you and show you what they truly found. And that has been very helpful, I found. Because, you know, doctors really want to get things right. But we can sometimes become defensive when we don't know. Because we were trained to know, and so some people don't know as well as others.
If you went to your own doctor and they gave you the bum's rush and blew you off, and you still continued to be sick, and is there any clinic that deals with it specifically that you can go to in Wisconsin or Minnesota?
There are Lyme-specific clinics. They tend to be by family doctors or internists, sometimes pediatricians. There's a new one that's going to open, and it's Dr. Thomas Salt is going to run it, and it's going to be in west central Wisconsin, but I'm blanking on the name. I'll try to get that information and I'll pass it on to Eric.
It'd be good to know.
Yeah. But I'm hoping that education will really help solve the matter. And there's a lot of great research going on, which will also help, because you know the more research the more we understand about the bacteria, then we can try to figure out how to kill it. Yes, ma'am, in the back.
I was going to ask you, is there work on a vaccination for humans?
Yes, so there are people working on vaccine. That's really been a problem. Boy, I would love to have a vaccine. The old vaccine was taken off the market in 2002, so if you had that vaccine, you should not count on that any longer. Your immunity from that is long gone. Some of the new vaccine is to get one that doesn't need to be boosted every year. And out of Virginia, they're working on a vaccine that would cover multiple tick-borne diseases, which would be great. It would be kind of like the MMR for tick-borne disease. But those are still a long ways off. One is in, I think, level 2 trials for safety, but that's still a long ways off. I wouldn't expect anything in 5 or even maybe 10 years. Yes, sir.
I have used peppermint essential oil to effectively remove the larger ticks, but the smaller ticks it seems to want to kill. Now, if that tick is embedded, how does that, what does that result in for removal?
Well,
if the tick is dead, is the removal harder or easier or what?
In some, it's not going. You're going to kind of probably get it out in pieces, but dead is good. I mean, I'm serious. I mean, but if that works for you, but my strong preference is to just pull the thing out. Do you put the oil on and then you just
I just wet my finger a little bit, put it on the tick, and it seems to work pretty quickly.
Does a tick come out?
Yeah, the larger ones kind of want to come out alive, but the smaller ones, they can't take it, so they succumb.
Interesting. Interesting. Find a researcher on that one. Yes, I'll get you to make one.
I'm wondering, there's a huge push to find some way to limit or eradicate mosquitoes? That seems to be a hot topic, to genetically modify them, spray for them, poison rats, and therefore mosquitoes will get poisoned. Is there any sort of approach to ticks for this, or is that just not prevalent enough across?
Great question. There's a couple of things going on with modifying ticks. There was one where they were going to put genetically modified mice, no, I think it was mice on an island out east to see if that would work. And they were really working with the population there to make sure that the citizenry, that everyone was okay with this.
Enough for ticks?
But then last year I heard a lecture where they were doing, and this is above my pay grade, transgenic things with injecting tick eggs. Yeah, I mean, it was pretty fascinating. I think where was she out of? She was out of Texas, I think. Not where I usually think of ticks. So there is some work on trying to modify the ticks so that they can't carry, and then to modify the mice so that they're not a reservoir. Yeah. I'll get you, I'm going to get Liz in the back. Go ahead and.
Yeah, I've had great success with this little apparatus from the vet that's called a tick twister. And it kind of has a V, and then you put it in it and you twist it out, and it doesn't make a big hole in your skin when you pull it out.
Okay, so yeah, there are other devices. You know, I usually give it, when I speak to the doctors and I'm trying to make them come into my booth, I give them a tick remover. But I just figured most people have a pair of tweezers. But if you have one of those other things, that's great. And right, yes, sir.
Deer hunters and turkey hunters
are
not going to wear white clothes.
I know. Permethrin.
The prevention sprays.
I would do that permethrin everything that doesn't have a smell. The turkey hunters I really worry about, because that's when the nymphs are really going. Yes, sir.
So, two parts to this. So with the prophylactic antibiotics, there's kind of 10 to 20 days. It's kind of a wide range.
It certainly is.
Is there what's the evidence for the dosing beyond?
Okay, so for the extended range on the antibiotic prophylaxis of 10 to 20 days. Thank you for that question. So the studies were done in mice and with the CDC, and they were comparing it to the single oral dose, which is the most common thing people are given if they have a tick bite. And they compared it to a long-acting injectable of doxycycline. And what they found in mice is that the single oral dose was only 43% effective, and they know that because they sacrificed the animals. But the long-acting injectable had this low-level measurement available for 19 days, 100% effective. And if you put ticks, when they put ticks on that had both Lyme and Anaplasma, the effectiveness of single dose dropped to 20% for preventing Lyme disease and 30% for preventing anaplasmosis. But that long-acting injectable was 100% effective for both. The bummer is the company that was developing the long-acting injectable got bought out, and the new parent didn't have any interest in the product. So research on it went away. And so that's the evidence. Being a practical person, I know that we use for relapsing fevers shorter protocols. So that's where I can logically get to 10, but I certainly don't want to do single dose. Because if I'm going to prevent, I want to prevent. But when I'm talking to my colleagues, I have to be more evidence-based, and so it's like, well, here's the evidence that we have.
So the extended dosing would be 200 milligrams per day for 10 days?
Yeah. And if that Wisconsin Medical Journal paper, when I wrote it so that physicians could read it quickly, and so we have people bring it with them when they have a tick bite, and you can get it off my website. And doctors actually then will give you that. So, I mean, well, that's a good thing.
So question and a comment. My husband goes out in the woods a lot looking for mushrooms, not hunting, but he hunts mushrooms. And so he only goes by those logs that are down in the woods. So we found a gallon of Permethrin at Fleet Farm for $20.
Oh, yeah, you can do the washing machine. I mean, I can't legally, but if you go online, you can find the recipe for how to make your own permethrin products.
But then I had a question. So let's say in hypochondrial Lyme, you're reading all of your symptoms of Lyme disease, and you're like, okay, so kind of almost all of those apply, maybe, just hypothetically. Can you possibly have Lyme disease for like a lot of years? Or have you ever seen cases where someone's had Lyme disease for years and like not known it, or just?
Yes, people can have smoldering cases of Lyme disease for decades. And they know that in one study, it went from the rash to the central nervous system in 26 months. And that was by Erythema, and to the peripheral nerves in 16 months. So it can be a while, and that's why it's so hard. People don't make an association. And then most people don't have a known tick bite, so that complicates it as well. If you have Lyme for a long time, generally I would expect to see symptoms in many different body symptoms. So if all your symptoms are just gut, and you don't have any joint pains and no nerve pain and nothing else, then I think that makes Lyme less likely.
What would you say to your doctor? Like, I want to be tested for Lyme, or what are the tests? You said blood tests isn't really.
I would just ask a more open-ended question. So, gee, I had these symptoms, we've been looking at for a while. Can we review all the possibilities and then kind of inject Lyme in that way?
Folks, I believe that Betty will be glad to stay around for a few minutes afterwards if you have additional questions. But can we all give a round of applause? Just a brief reminder that our next program next month is a presentation that's on the interaction between fungi on the roots of trees and small mammals, and the fact that small mammals can actually change what the nature of a forest is all about. So that'll be on the 15th, is that right?
Is that the last one until the fall?
The last one until September, yeah. So, great. Thank you all for coming tonight, braving the weather. And
don't forget the goodies.